And so being in alignment with the intended parents about what the plans are, what decisions you would make if X, Y, or Z happens is so important because you're really in this together. You're really putting literally your eggs in her basket. When we've seen these journeys work the best is when those two parties are really in alignment with how they feel, how they're supporting each other, what decisions they would make, how they would communicate those decisions. All of those sorts of things really need to be on point.
Hi, superhumans. I'm Dr. Mavis Garcia.
And I'm Dr. Wise.
We're two of the physician leaders at Markham Fertility Centre, otherwise known as our baby, MFC.
As fertility specialists, we've witnessed firsthand the challenges, triumphs, and the myriad of emotions that come with trying to conceive. Whether you're just starting to think about having a baby, actively trying, or facing challenges along the way, My Fertility Podcast will be your go-to resource for honest conversations and a supportive community.
So grab a cup of coffee or tea and settle in, and let's demystify the world of fertility together.
On today's episode, we are joined by Stefanie McGlynn, a fabulous nurse here at Markham Fertility, who is also the program lead for our donor and surrogacy program. She is a wealth of knowledge, and she knows all the ins and outs of all things donor and surrogacy related. We're specifically going to be talking about surrogacy or gestational carriers.
Welcome. It's so nice to have you back, Stefanie.
Thank you, Dr. Garcia and Dr. Weiss, for having me today. I'm excited to talk about surrogacy. I will admit this is the one part of donor and surrogacy that I feel is like drinking from a fire hose. There's the most to know, so I'm excited to get into it.
Yeah, so that means that we really need you here today.
Before we get too deep into it, first of all, Steph, why don't you tell us about the donor and surrogacy program here at MFC? Because I think it's really one of the jewels in our crown, if you will.
Thank you. At MFC, we have a dedicated donor and surrogacy program, which consists of myself and another registered nurse and some administrative support. And our job really is to support families and donors and surrogates and patients who are coming through with any of the doctors and using the support of a third party. So whether that's donor sperm, donor egg, embryos, surrogacy, or some combination of the above, we're here to support those patients in first accessing whatever third party element they require. So we help them sort of navigate the systems to get to the place where they have all of the pieces of their family building puzzle. And then we support through the cycle itself, and then through first trimester pregnancy and beyond, and whatever aspects are necessary. Sometimes people think that we have donors here or have surrogates here, and that's not the case. We're a conduit, we're a supportive process to help sort of administratively get everybody where they need to be at the times they need to be there in order to build your family.
Why do you think a specific donor and surrogacy program is necessary for fertility clinic?
I think that it's really, at least from our perspective, we are able to really dedicate ourselves to learning the landscape of third-party reproduction in Canada and North America. We don't always know everything about every agency or every donor bank or every situation that's out there. In fact, we almost never know everything about it. But because this is what we do day in and day out, we've become really familiar with who we ask the questions to, what regulations are going to come into play in this situation. We're able to anticipate the questions that need to be asked in order to make your experience as smooth as possible, differently from people who are doing sort of, I call it normal IVF or boring IVF, when there's only two people involved. And we're able to sort of see the bigger picture and ask more questions. And I think that the other thing is we can really speak to patients and let them understand that they're not alone, because our whole full-time job is supporting these kinds of families. And we are really excited and energized by the complexity of the cycles that we see coming through. And I always feel like you've completed like a 5,000 piece jigsaw puzzle when you get one of these people to the end goal, which is baby. When those babies come back, I always feel like our jigsaw puzzle has completed and all of those pieces fell into place perfectly. And now we have this baby here as proof that it all worked.
Amazing. So let's dive into surrogacy in Canada. As you mentioned at the beginning, it's a complex topic. There is a lot to know. Why don't we start by defining what surrogacy is? What is the difference between a surrogate and a gestational carrier? And what are the types of surrogacy that are out there, even if we don't necessarily use all of them?
For sure. So we very commonly in the industry and just I think in the community use the word surrogate, but actually a surrogate is a person whose egg has been used in the process of building that pregnancy. So in the past, what we call traditional surrogacy would have looked like taking sperm from an intended father, inseminating a surrogate, and then the idea was that that baby would be given back to the intended parents for them to raise as their parents, but it was the surrogate's egg that was used to create the pregnancy. Now, what we much more commonly see are gestational carriers, which is a person whose egg was not used, but the intended parents have created an embryo and the embryo is transferred into the surrogate to carry the pregnancy. Traditional surrogacy is not something that we are able to support here at Markham Fertility Centre. And I think it is maybe still accessible in Canada in very small pockets, but it's tricky. It's much trickier to access than gestational carrier cycles.
Let's say we have a patient in front of us when we are starting the conversation around a gestational carrier or a GC. Where does somebody start? Where does somebody even start looking for information?
That's a really good question. And so when it comes to finding a surrogate, people can go to many different places. The most ideal cycles or journeys tend to be with people who an intended parent knows in their life. So maybe a friend or a relative or somebody in their circle who they've sort of connected with who offers to act as their gestational carrier or their surrogate. In this conversation, we're going to use the word surrogate, but as we talked about before, we really mean gestational carriers. So these are people whose eggs have not been used. The sort of most economical, the fastest, and the smoothest cycles tend to be with people who you know in your life. And a lot of people, when they first start looking, think, I don't know anyone. And they also very often have a lot of reservation about asking people in their life or letting people in their life know that they're looking for a surrogate because that's really vulnerable, especially if it's a male female couple. It's very much like kind of really for anybody, it's very much like announcing to the world that you're trying to conceive, which most people don't do. We usually don't talk about this until we've past that first trimester pregnancy. So putting yourself out there and saying that you need this person can be really scary, which I very much understand. But if you can find those people that you connect with and talk to them, it really is worthwhile. And it's surprising how people never thought that so-and-so would be willing to do this, but they stepped up and were happy to help. Outside of that, which is definitely not accessible for everyone, the next place to look in Canada, at least, is with different surrogacy agencies. So these are companies who help to find and do some level of screening on people who may be reasonable surrogates, and then connect those people with intended parents who are looking for a surrogate. There are many, many different companies that are doing this in Canada, and there are pros and cons to each of them. And their process is all really different. Each agency, their costs, their timelines, how they operate, how they communicate, it's all very different. And then outside of agencies, so somebody somebody you meet through an agency. And then the other way that people are finding surrogates, especially now, is on social media and just connecting with strangers essentially through things like Instagram posts or Facebook posts or blogs or things like that. People are finding these independent journeys and connecting with surrogates on their own. That part for sure requires more effort and more work and more back and forth for the intended parents. But there are different companies out there as well, consulting firms and things like this that can help intended parents navigate those journeys.
Steph, why don't you tell us why it's so difficult to find a gestational care in Canada, and how long can prospective intended parents have to budget for in terms of matching with a gestational surrogate?
If you're looking for a surrogate, either through an agency or one of those independent journeys that we talked about, you can expect to take anywhere from maybe 18 months to 2 years or more to find your surrogate. And the costs associated with that wait time really vary depending on which agency you're working with or which consulting firm you're working with. Sometimes you have to pay sort of an annual fee to stay rostered with that particular company. And other times you just pay one fee and can hang on until you're matched. But it really does vary from time to time. And it's difficult to find a surrogate because these surrogates in Canada are not being paid for their services. In Canada, it's not legal to pay somebody to be your surrogate directly. They do get reimbursed expenses. So there's a pretty prescribed list of things that they're able to get reimbursed for, like time from work, childcare for their own kids. They're not going to incur any travel costs or the cost of their prenatal vitamins or whatever, but they're not being paid like they are south of the border in the States. So finding somebody who wants to do this really out of the goodness of their heart is kind of sometimes difficult to do. And then also when we're choosing a surrogate, we really want somebody who we think has the best chance of success. We don't want you to go through this whole process only to be matched with somebody who maybe doesn't have the best chance or the optimal chance of conceiving to begin with. Not only do we have to find this needle in a haystack of a person who's willing to give up their life for a year or more in order to do this and interrupt their family and their job and all those sorts of things, but we also have to find a person who's willing to do all of that and meet this list of criteria that our doctors here have set out to make sure that the person that we're choosing has the best chance of helping to build your family.
As you brought up the criteria for what we're looking for in a surrogate, certainly I think every clinic, every organization will have different criteria in terms of what they are looking for, what they deem to be a quote unquote good surrogate. Can you speak to the MFC criteria in terms of what we're looking for?
For sure. And you're right. It is really important to highlight that every clinic is different. So just because your surrogate may not meet criteria here, it doesn't mean that they wouldn't somewhere else. It's important to just keep that in perspective when you're listening to this list. Here at MFC, we prefer somebody who's a Canadian citizen or a permanent resident. We want somebody to be between the ages of 21 and 45. We would like a BMI under 45 with no metabolic disease like diabetes or cholesterol issues or blood pressure issues. For sure, and this comes up a lot, we want somebody who's had at least one prior birth. We very often get that question about, can my sister who's never been pregnant be my surrogate? And at MFC, we say no. This might be a good time to talk about that because it does come up quite a bit. Can you guys speak to the requirement for having had at least one birth before in a surrogate?
These criteria, Markham Fertility Centre, we spend quite a bit of time thinking about it. And the reason for that is number one is medical reasons. So nulliparity, which means never having had a pregnancy, is a risk factor for some medical conditions, like, for example, preeclampsia. The best predictor of a term healthy pregnancy is a prior term healthy pregnancy. So we want to make sure that your surrogate has able to do that in the past so that we can go into that journey with you having fairly good confidence that this is a body that it's able to do this. Unfortunately, there are no tests that we can do prior to being pregnant to look at risk of preterm birth and preeclampsia and stillbirth and growth restriction. Of course, there are some things that we can do, like a sonohistogram and an ultrasound, that would exclude your surrogate. But the fact that everything is normal in a person who's never conceived and who's never carried a pregnancy to term, normal tests do not mean that this person is not going to have a high risk pregnancy and a very complicated pregnancy. That is one of the reasons for that. And the second reason is that a person who's never been pregnant, it's hard to understand how they're going to respond to the pregnancy. What is the risk of postpartum depression, pregnancy related anxiety? Even if they don't have any medical complications, are they going to have severe hyperemesis gravidarum, which could be really tough mentally and physically for people? How are they going to be able to understand the challenges, manage giving birth, and then giving the baby back to the IPs? I think those are things that it would be very hard to understand unless you've been through a pregnancy already before.
Yeah, I totally agree. I think about especially the sort of social emotional implications of that quite a bit because as somebody who has been pregnant before, I think it's really hard to conceptualize what that feels like until it's happening. Just continuing on our criteria, we say no more than 3 C-sections and no more than 5 previous vaginal deliveries. And the reason for that is, again, about the increased risk of complications for those pregnancies once they become pregnant. And then no history of serious pregnancy, delivery, or postpartum complications, and no premature birth. So before 34 weeks gestation. unless the most recent birth was at full term. No serious health issues, excellent physical and emotional and mental health. Be willing, along with a partner, to undergo psychological and medical assessments, provide all medical history, and maintain up-to-date infectious disease testing every 6 months. They should reside in a stable residence and not planning to leave the country after the 20th week of pregnancy. Ideally, a good support system at home, and no serious history of clinical depression or other psychiatric disorders. It's important to know that, like, all of these people that we are using as surrogates have had babies before, and very, very often people will have experienced maybe postpartum depression or anxiety, and they may be taking a medication for those. And that does not exclude them from being a surrogate at all. But it's something that we would be talking about and working with them on understanding if their mental health treatment is supportive of a surrogacy journey or if it's a little bit more serious and needs to be reconsidered. Of course, they need to be willing to take IVF medications, including those progesterone and oil injections, the intramuscular injections that nobody likes and are super painful and a little barbaric, but unfortunately the best thing that we've got. And so surrogates do have to take those. And then be willing to travel to our clinic to work with their doctors and their lawyers and their counselors. They need to be able to take time away from work. They need to have a family situation that's supportive of them doing their treatments and their appointments. And then they need to be drug and alcohol free with no abuse of either for currently or for the last 3 years. And if they're a smoker, they need to be willing to abstain for 3 months prior to the pregnancy, and then, of course, during the pregnancy as well.
Certainly, we have a very robust DNS program here that we're extremely proud of. I think it's important to talk about other clinics as well, and in terms of how that might work, and then how patients could potentially be referred here if they're interested in pursuing surrogacy.
For sure. So just like with anything DNS, some clinics offer all the different aspects and some just are able to offer certain aspects of DNS journeys. It's important to know that not all clinics offer surrogacy journeys. And even if they do, some clinics are restricted to only offering surrogacy for your friend or your relative. They won't work with agencies or other subcontractors to complete a surrogacy journey. And just like we have talked about before with anything DNS related or really anything related to your fertility, it is important to choose a clinic understanding what they're able to offer and what their limitations might be and build your family's planning that. If you're interested in pursuing surrogacy at MFC or really any clinic for that matter, in Ontario, the way to do that is to get referred. If you are an Ontario resident, you can be referred by your current clinic or by your family doctor. Or if you are somebody who doesn't have OHIP, is not within Ontario, you can email referrals@markhamfertility.com with your information and self-refer.
Why don't all clinics offer surrogacy? I mean, I think that's the question that kind of comes out of that, right? Why do we do it? Why do other people don't?
Because it's hard.
I agree with Stephanie. It's really hard.
It's hard.
That's the question I think that everyone's going to ask, right? Why doesn't my clinic do this, right? Why is it hard?
I do think it comes down to the level of complexity in these journeys and the just increasing liability, of course, to the clinic with every increasing step of complexity. We haven't really touched on this, but one of the things that I think a lot of clinics are worried about, and honestly, I worry about too, is how agencies in Canada work. And there are some pitfalls to be worried about there for sure. There are amazing surrogacy agencies out there without a doubt, but there's also some pretty bad experiences that have come up. And I'm sure a quick Google search will explain lots of those to you. So I think that's part of it is sort of the liability of getting in and how do you vet these companies that you are agreeing to work with and what happens when things go badly and all of those sorts of worries and liabilities. I think that the other thing is if there's other people, other clinics that your patients can get this service from, then some of the smaller clinics or the clinics with less resources are inclined to just let those clinics be experts in that and then close the loop on what their offerings are.
Yeah, it is definitely a resource issue. It takes a lot of expertise. Like, we had to invest in creating a robust donor and surrogacy program. When we took over leadership of the clinic in 2021, we made a conscious decision to expand the program, hire another nurse, the genetics department, hire a admin. It requires a lot of work and a lot of resources and a lot of expertise. It's something that I understand why some clinics may not want to do that. Here at Markham Fertility Centre, we're very proud of our program, and I'm very glad of the decision that we've made to invest in the program and grow the program. And we're lucky to have superstars like Stephanie and Carla with our program. And I think that is really one of the reasons we're so successful, because of the people here that make the program a success. So if other clinics are listening, you're not allowed to take Stephanie
Or Carla.
or Carla.
Over our dead bodies.
And also, you don't have to open your program any further. We're happy to take your patients. That's okay.
It's true, though. I mean, it's like with anything, right? When you do one thing once every 6 months, it's significantly harder when you don't have that process in place. When you're doing something on a regular basis because you have the volume of it, it's a lot easier when you're doing it multiple times per month. So I think the experience with it and being in it all the time and sort of knowing all the ins and outs of the agencies, the programs is so crucial.
And honestly, even with this dedicated program and the fact that this is all we do day in and day out, I learn something new, especially about surrogacy every single day. And I'm always asking patients, you tell me what you hear, tell me what you're seeing, tell me what your experience is, because every single journey is so different. And it feels like this unending list of providers that you can go to, the different agencies and a different concierge service and a different online group that helps support people with connecting. It feels endless. And so even though I work really hard to know as much as I can or to hear as much as I can, I'm still every day getting new information. So I really can't imagine doing it once in a while because there's just so much.
So, Stephanie, we recorded a podcast episode with Jason and Daniel, who are a same sex male couple that use an egg donor and a gestational carrier to grow their family. And they spoke about the relationship that they have with the gestational carrier and the gestational carrier's family. In your experience, having been part of so many journeys, can you talk about that a bit?
I think it's the most important part of choosing a surrogate. And I talk about this with patients a lot. Even with egg donors, the same is true, but especially with surrogates. We need, of course, somebody that meets all those criteria, without a doubt. But we also need this other thing that is not so tangible, that you can't really put to words. That's this like bond, this relationship the intended parents and the surrogate can have together, and the surrogate's family, of course. Journeys where that is fluid and open and comfortable are so much better than the more transactional journeys. And we have seen transactional journeys for sure, where somebody is here to provide a service, not that they're getting paid, not money transactions, but here to provide a service, and they're just doing this thing for this person, but are not necessarily as open and connected as others. And that connection is so important. And it starts at the very beginning. The surrogate that's going to carry your baby, you're literally putting your child in their body. It's a huge commitment. And you really have to have a lot of trust in that person. And they have to have a lot of trust in you and understanding that you're going to be confident that they're going to do the best that they can to make this as safe and successful as possible. And something that comes up a lot of times, patients will ask about, like, okay, once the surrogate becomes pregnant, what am I allowed to know? What am I allowed to make decisions about? And all those sorts of things. What's really important to know is that the surrogate is the decision maker in that, formally, when it comes down to it. Once the surrogate becomes pregnant, the decisions about what happens with that pregnancy are hers. And so being in alignment with the intended parents about what the plans are, what decisions you would make if X, Y, or Z happens is so important, because you're really in this together. You're really putting literally your eggs in her basket. When we've seen these journeys work the best is when those two parties are really in alignment with how they feel, how they're supporting each other, what decisions they would make, how they would communicate those decisions. All of those sorts of things really need to be on point. I listened to that episode. It was episode 15 with Jason and Daniel, and listening to them talk about how connected they were with their surrogate. I remember, like, it was yesterday. I was driving down the 407. It was sunny. I went under an overpass, and that's when they were talking about it. And it was like, yes, that is what surrogacy should look like. That's how it works the best, when you're really in it together.
I can see why people sometimes may just be desperate, or they just want to, mash and get it done already. And they might sort of suppress this desire to over communicate, or they might don't want to be themselves. I know Jason spoke to that, right? He says you want to show up as who you really are. A lot of times people have this tendency to hide who they are and not be themselves because they don't want to be judged, and they feel like the surrogate has to make a decision about working with them. I can see the temptation to do that and show up as a different version of yourself, one that you think the surrogate is going to like better than who you truly are. I would imagine that rarely goes well because this is not a one-time thing. This is a relationship that can go over a long time, and you just never know how the pregnancy is going to go, what decisions have to be made. So I think that's really important. And Jason and Daniel did a really good job in explaining that.
It's like when you show up on a first date and you've got your hair done, your makeup done, you got the great outfit. If you're like me, you're sucking it in. But eventually your partner will sees you out makeup. Eventually they see the real you, right? It's a little facetious, but it's actually kind of a good analogy in the sense that this is a long-term relationship potentially with the surrogate and the surrogate's family. That it is the 9 months of pregnancy, but then you really need to talk about what the expectations are going to be for afterwards and after the pregnancy is complete, and what that relationship might look like between the surrogate and or their family and the IPs and the children, and what that looks like to everyone, because everybody might have very different ideas.
The analogy of dating comes up a lot. It really is like dating. And people ask me all the time, what do I put on my profile so that I have the best chance of matching with somebody? And I totally understand where those questions are coming from. But ultimately, you have to be yourself because you have to connect with somebody who is accepting of you and who you are and who your family is so that this works the best. And it's really strange, I think, in that way, but that ultimately is what it is like. And the other thing that I was thinking about while you were talking was that number one, this is a person who you need to make decisions with during pregnancy and beyond. I mean, hopefully by then you will have had lots of time to establish that relationship and things will be a little bit more clear because they've developed a little bit organically over time. But the other thing that I think gets overlooked a lot when we're choosing surrogates, especially by the surrogates, the fertility patients are all expecting bad news. They're very well aware that things can go badly, that it might not work, that a miscarriage might happen. Surrogates come to us usually really unconcerned with the bad things that might happen during a transfer cycle. They really come in expecting that they're going to get pregnant, they're going to have 9 months of pregnancy, they're going to have a beautiful delivery, and everything's going to go really well because we're picking people who have really good fertility history. So they usually haven't experienced a lot of loss or bad outcomes in their pregnancy journeys so far. And so when we do have a transfer that doesn't work, or unfortunately a loss in the pregnancy, it can really come as a huge surprise to them that this is something that can happen. And so I talk a lot with intended parents at the beginning about walking that balance between you want to support the surrogate's excitement. We want her to feel good and excited about all of this, but we also all want to be on the same page that everything might not go the way that we think that it will. And what does that relationship look like? How can you support this person if things don't go so well? And what is that communication like? And how do we connect with her so that we can support her through those difficult times, should that be something that comes up?
There are many Health Canada requirements for people who are looking at surrogacy journeys. We've talked about it before, but I think one of the ones that always causes a lot of stress or anxiety is counseling, and the strong recommendation for counseling. And it's a requirement here at Markham Fertility Centre. Can you talk to us about that, the counseling?
For sure. So usually people are a little bit more accepting of the counseling in surrogacy journeys because it's pretty clear that this is going to be a complex sort of relationship that we need to build. At MFC, we don't have a requirement that you do the counseling with any particular provider. We offer a list of recommended providers. You can also use somebody that you're comfortable with. And there's different ways that they do it. Sometimes it's IPs talk to the counselor and then surrogate and her partner talk to the counselor. If surrogate has a partner, the partner should be involved in that session. And then other times it's IPs, surrogate, and then a group session together. Those are the ones that we like the best for obvious reasons. They offer the best transparency and the most in-depth conversations with everybody. The stuff that's talked about in those sessions are things like, how do you feel about how many embryos might be transferred? What are the emotional thoughts about what happens if we get pregnant with multiples that we weren't expecting? Or What if the doctor recommends ending a pregnancy for a particular reason? What is the relationship going to look like? What is the communication going to look like? What happens after birth? What does that look like? Who's in the room at delivery and who holds the baby first and who cuts the cord? And all of those sorts of things they discuss in that counseling session. People usually find it really helpful. And it also helps to sort of feed into the legal agreement, which is something we also didn't talk about. But in every surrogacy journey, of course, the intended parents and the surrogate will have a legal agreement together. And in that agreement, it's a very detailed contract, and it will talk about things like how many transfers do we agree to, how many embryos do we agree to per transfer, which, by the way, at MFC, we mostly only do one embryo transfer into a surrogate, almost always, just for the record, because that comes up a lot too. The other things in the legal agreement might be who's in the delivery room, who holds the baby first, what does breastfeeding look like, what level of contact are we okay with, what happens if we get pregnant with multiples and selective reduction, and all of the different sorts of things is really detailed, and counseling sort of helps go through some of that in order to then get to the lawyer's office and sign on the dotted line. And so those sessions usually happen after medical screening so that you are aware that this is a person who medically is suitable to proceed as your surrogate, and then we can get into the nuances of it. When it comes to legal, it's important to say that if you are somebody who is going to pursue either an independent journey or an agency journey, really, really recommend talking to a lawyer who's familiar with surrogacy law in the jurisdiction where your surrogate will deliver as early in the process as possible. Not that you're going to be writing an agreement on day one, but just to get you thinking about all of these different things so that when it comes time to do the agreement, you've had lots of time to ruminate on all of the different questions that are going to come up so that you can, I think, feel less pressure to make decisions and sign on the dotted line when your surrogate's ready for transfer. Something else that we didn't touch on is that surrogates come from all over the country, and we can just keep it to even just surrogates in Canada. And where your surrogate's going to deliver, which province, really matters when it comes to how you become the legal parent of that child and what happens after delivery. So it's really important to get good legal counsel on where your surrogate's from and how that might influence or change some of your decisions around your surrogate and how the journey is going to play out.
Stefanie, there is legal cost, there is counseling cost, there is agency cost, there is the transfer cost with the fertility clinic. Can you give us an estimate of how much money should couples be budgeting for when they're thinking about a gestational carrier journey, let's just say in Canada?
It's a tough question, and it's one of those moving targets that I'm constantly chasing because so much of the cost comes outside of the clinic that I only kind of have an idea about what people are paying. But when I've spoken to intended parents, I've spoken to surrogacy agencies. The number in Canada that I've looked at for a surrogacy journey with embryos already made, so not IVF costs, but now we have embryos and we're getting a surrogate, between $80 to $120,000. And the reason there's such a variance there has a lot to do with which agency are you using? Where does your surrogate live? How much are her travel costs going to be impacted? What's her job? What does reimbursement look like for time off from work for her? There's a huge range in what a person might be paid and how that reimbursement would look like. And then what are her household costs? How many kids does she have? When you're reimbursing childcare, what does that look like? There's a huge range in sort of what reimbursements look like. If you're choosing a surrogate who is not with an agency, so an independent journey or somebody who you know, the costs you would think would be less because there's not agency fees involved. So if you're bringing us your own surrogate, then the costs to think about really are just clinic costs, legal, counseling, and then in your legal agreement, whatever you've agreed to reimburse for your surrogate. So the cost would be lower from there.
Understanding what you mentioned before, that it can be up to 2 years and what the costs involved are, when should people start looking for a gestational carrier if they think that this is something that they're going to need in their journey to become parents?
There's no right or wrong answer to when you could explore agencies and things like that. If you are a family, for example, a same-sex male couple or a different version of a couple, but you don't have a uterus, then I would say starting as soon as you decide to have children is not the wrong thing. Lots of times, especially same-sex male couples, come to us after having already connected with an agency. So the agencies used to be, when I first started, they didn't want to roster anybody who didn't already have at least 2 embryos for transfer. That's doesn't seem like it's the case so much anymore. They are onboarding patients while they're making embryos, but it's important to know that an agency really needs to see that you either have embryos or you're currently making embryos in order to start matching you with surrogates, because surrogates are ready to cycle now, usually. It's important to consider when you are somebody who may need a surrogate, it's really important to talk to your healthcare team ahead of time to really narrow down exactly when you should start looking, because there's many different factors that are involved there around when you should start looking and what sort of things you might have to do ahead of time in order to make sure that that option remains available to you.
We've talked about a lot of different aspects, right? We've mentioned legal counseling, we've talked about psychological counseling, contacting agencies, doing the transfer. Can you give us a typical journey and what that might look like? Let's say from an intended parent couple has now decided or have come to the conclusion that they need a surrogate, let's say have embryos. Where do they go next and how does that process look?
If they already have embryos, then they would speak with their doctor, decide that they're going to look for a surrogate. If they don't have somebody in their life who they'd like to ask, then I would say there's two first steps. Number one, start reaching out to different surrogacy agencies or concierge services that you're comfortable exploring. Speak to many different ones, at least two, ideally three or more, so that you really get a feel for what's out there and understand what your options are and what the cost differences are and timeline differences and all of those sorts of things. And then two, as we talked about before, along with that initial reach out, I would really recommend having an initial consult with a lawyer that's familiar with surrogacy and wherever you plan to do it, so that you'd have a base of understanding for what the different considerations would be with all these different agencies that you might be contacting. And then basically you work with the agency, work with your clinic, you find your surrogate, which we talked about can take many months or years. Hopefully not, but very often that's the case. And then once you match with your surrogate, we call it matching, the agency will send us a match sheet, which basically gives us permission to then contact your surrogate directly and get her medical screening set up. Then she would be assigned to a doctor in our clinic, different from your own doctor, so they each have a representative in this journey. And your surrogate would have all of her necessary medical screening done, as her partner would. And then the doctor would meet with her, review the results, determine whether or not she's a safe and suitable surrogate to proceed. If so, you would be consulted. Everybody's in agreement that this is a go. We're going to do this thing. Then you would go to legal, start and or complete your legal agreement, start and or complete your counseling. And when those things are done, she could start her transfer cycle on her next day one, depending on her schedule and your agreement. And then she would complete her cycle. And the transfer cycles look very similar to what any other fertility patient sort of transfer cycle would look like. Very often we do medicated cycles, so there's a little more flexibility in the timing of it all. And then depending on where she sprums, very often we have surrogates that are far from clinic. So depending on where she sprung, her pregnancy test and her first trimester ultrasounds may happen here, or they may happen remotely close to wherever she lives.
Thank you, Stephanie. You're right. There is quite a bit to cover. It's exactly like you said. It's like drinking from a water hose when you start talking about surrogacy. Clearly, your level of expertise in this is second to none. So thank you so much for being here with us. We love you so much, your MFC. Our patients love you. And we're so grateful that you're so committed and dedicated to the donor and surrogacy program here.
Thanks for having us, and thanks for shining a light on donor and surrogacy, because it's awesome and it's out there. Lots and lots of people are doing this. And so it's really important to talk about.
And I think it's also so crucial to also keep in mind that every journey is so different and so individual, and that there's always nuances and particular questions. So even though, we've given this kind of broad overview, very general information, I'll go out on a limb and say that very few journeys look like that. It's really just a matter of talking with your doctor, talking with the amazing donor surrogacy team, and just navigating it all together. And I agree. Once we get to the end of the road, once we have baby in the intended parent or in parent's arms, it's all worth it. And that's a wrap for today, Superhumans.
If you're looking to connect, get social with us. Follow us on YouTube and Instagram at My Fertility Podcast, or visit us online at markhamfertility.com. And don't forget, follow, subscribe, and share your favorite episode.
Thanks for listening to My Fertility Podcast and for being a vital part of our community. We know you've got this.
We're signing off until next Tuesday.
If you found this episode of My Fertility Podcast helpful, please take a moment to head over to the review section and leave us your thoughts. Your reviews and comments are incredibly valuable to us and help guide future episodes. We also welcome you to direct your questions to info@myfertilitypodcast.com.
My Fertility Podcast is produced by Rabbit Media Inc. in conjunction with Dr. Garcia and Dr. Weiss. Music from Mix Kit Raising Me Higher by Ajay Stelino. My Fertility Podcast is not intended to replace any type or variation thereof professional medical, health, or legal advice, nor should the content be taken as medical advice. Please contact your primary healthcare professional regarding any medical questions you may have. The information presented in this podcast is based on the knowledge and understanding of the host at the time of recording. Medical knowledge is constantly evolving, and new research may change the understanding of health-related topics. While we strive to provide accurate and up-to-date information, we do not guarantee the completeness, accuracy, or timeliness of the content. The views expressed in this podcast by guests are not those of the host or the management. This podcast is not intended to impose any type of discrimination. My Fertility Podcast and its management are not responsible for any losses, damages, or liabilities that may arise from the use of this podcast.